Good afternoon, everybody. Today I'm going to talk about primary health care. This is Dr. Sumanth Prasad from the Department of Public Health Dentistry. This chapter will be covered on the following headings: Introduction, Levels of Health Care, Elements of Primary Health Care, Principles of Primary Health Care, Primary Health Care in India, and References. Now, health is a fundamental human right. Each state is responsible for the health of its people. When you look at health, the factors that affect health are the physical environment, the food that we eat, the housing facilities, sanitation, lifestyle factors, socio-economic factors, etc. In general, when you look at healthcare delivery, you know that healthcare is urban oriented, mostly curative in nature, and accessible only to a part of the population. To overcome these barriers, the WHO, in an Atma Atta declaration in 1977, they came out with what is called as primary health care. This concept says that health is a fundamental right. In India, health comes under state right. That means the state government is responsible for the health of its citizens, less of the central government. State government only has to take care of the health of its citizens. Now, the health care delivered should be comprehensive, accessible, acceptable, and affordable. Let us look at what are the various levels of healthcare delivery. At the first level, you have the primary care level. It is the first level of contact of individuals, family, and community with the national healthcare system. Primary health care is provided by a complex of primary health centers and sub-centers through the agency of multipurpose health workers, village health guides, Asha workers, and trained dais. Meaning, since healthcare is more in the village level, is less in the village level, and health has to be accessible to the villagers, but the number of people who are working at the village level, doctors, are very less. So who are the people who are in close contact with the community? So the people who are in close contact with the community, especially in the village levels, are these multipurpose workers, village health guides, Asha workers, trained dais. They are the primary care level, or the first level of contact between the individuals and communities with the national healthcare system. Along with this, we have what is called as sub-center level and a primary health center level, where people can even go to these levels for their services at the first level. If at all the problems are not solved in the primary health care level, it is referred to the second care level. At this level, more complex problems are dealt with. In India, this kind of care is generally provided in the community health centers and district hospitals, which is called as the first referral level. Now, supposing you are going to a primary health center, say for dental services, but there the availability of services is only the basic dental services, depending upon what the state government facilities have been provided. If the procedures cannot be handled there, if the case cannot be handled there, it is referred to the secondary care level, and the secondary care level is called the first referral level, which is the community health centers and the district hospitals. If care is not dealt with in this center, then it is referred to the third level called as tertiary care level, wherein you have specialty and super specialty services. Now, in tertiary care level, more specialized care that is more than the secondary care level. You have facilities at this level where facilities with all facilities, equipments, all departments, everything is provided at this level. That is, you have, say for example, in Jaipur, you have the SMS hospital. In the private sector, you have, say, Mahatma Gandhi Hospital, where all the departments, all the super specialty services are available. So if services are not provided in the lower sectors, they can always come to the tertiary sectors for their treatment. This is called as tertiary care level. That means the government has levels: primary level, secondary level, tertiary level. If things are not handled at the primary level, it goes to the secondary level. If things are not at the secondary level, it goes to the tertiary level. In the tertiary level, it is all the hospitals which have super specialty services. That is called the tertiary care level. Like you have, even in Delhi, you have All India Institute of Medical Sciences. There are so many All India Institutes of Medical Sciences. Those are all tertiary care levels. Any hospitals which have upper services, you say that is as tertiary care level. Now let's look into the definition of primary health care. Primary health care is an essential health care that is made universally accessible and acceptable to the individuals and families through their full participation and at a cost that community and country can afford. In a sense, primary health care deals with basic essential services, as basic services which are essential, which are utilitarian in nature, and it should be made universally accessible. Everybody can have access to it, whether it is the urban, rural, rich, poor, everybody should have access to it. It is to the individuals and to the family, and it should be acceptable to them, and through their full participation and at a cost the community and country can afford. Let's look into what are the basic functions or elements of the primary health care. The basic functions of primary health care are educating concerning the prevailing health problems and methods of preventing and controlling them. Number 2, promotion of food supply and proper nutrition. Number 3, adequate supply of safe drinking water and basic sanitation. 4, maternal and child health care services including family planning. 5, immunization against major infectious diseases. 6, infection prevention and control of local endemic diseases. 7, appropriate treatment of common diseases and injuries. 8, provision of essential drugs. I want you to know all these 8 services could be either in the form of educating them regarding the current problems, or could be with respect to the nutrition, or it could be with respect to safe drinking water, or it could be mother and child health care, or it could be again vaccinations or immunization programs, or it could be on locally endemic diseases, and in case there are any injuries or common diseases, appropriate treatment should be given to that. All along with that, you will include certain services like provision of essential drugs. These are the 8 essential elements of primary health care. Let's look into what are the principles of primary health care. There are basically 4 principles of primary health care. They are equitable distribution, community participation, intersectoral approach, and appropriate technology. The first one is primary health care, that is equitable distribution. Now when you look at the healthcare services, you find that more amount of people are actually in the rural areas, that 70% of the people live in the rural areas and 30% of the people live in the urban areas. But when you look at the healthcare services are mainly in the urban areas, but only 30% of the population live in the urban areas. 30% of healthcare is in the rural areas, but 70% of them live in the rural areas. That means there is social injustice. Presently there is social injustice. It's predominantly urban oriented. Less amount of services are actually present in the rural areas. This is called as social justice or inverse square law. The present system helps to change the center of gravity from the urban health centers to the rural care centers. Now when you look at this, Currently, what the government of India is doing is, say, they're planning to open up almost every district, they're planning to have a medical college. That means they're trying to bring in services more close to the people. Equitable distribution says distribution of services which is equally available and accessible to everybody, whether it is rich, poor, urban, rural, all religions, all caste, irrespective of any inequality, services should be available. That is the reason why the government is striving to bring health care more closer to the people by bringing in more amount of services, because the people live more in the village areas, in small towns. The government is trying to put this action by increasing the number of facilities everywhere in the country. So definitely there is going to be what is called as equitable distribution. If you have the present system that many people are actually living in the urban areas and services are concentrated only in the urban areas, and minimum facilities are available in the rural areas where maximum people are residing, that means it's going to be social injustice. So present shift is the government is trying to shift the balance from the urban areas to the rural areas such that everybody have access to health care. Next is community participation. Now, health is not care delivery is not possible only if the government is trying to give its services. We require not only the doctors to be involved in healthcare, but the people also should be involved in the delivery of healthcare services. That means there should be an active involvement of the community in providing healthcare to its people. So the people should be involved in the planning, implementation, and maintenance of healthcare. That is, the healthcare should start from the people. It should be of the people, for the people, and by the people. When you do this, you're trying to place people's health in people's hands. Say, for example, the government has come up with what is called as village health guides, local dais, Anganwadi workers or ICDS workers, Asha workers. They are all chosen from the village to which they belong. They are given a basic simple training and they are asked to provide basic services to the village people. Because you're choosing them from the village and they're providing the services in the village, that is called as placing people's health in people's hands. That is the second part. Okay, community participation. Third is intersectoral approach. In intersectoral approach, health cannot be provided by the health sector alone, whereas other sectors of health are also equally important for improving the health of its citizens. In this, you have education department, the communication department, animal husbandry department, public work department, social welfare department, etc. All of them should come together such that they have a strong political will, and only by close action and coordination you will be able to provide services in a planned way. Moreover, there should be avoidance of duplication of services. Only when one particular health sector is alone not giving the health of its people, looking after the health of its people, but it is all other sectors are trying to coordinate with the health department in improving the health services. For this, again I am repeating, it requires a strong political will and a coordination between various sectors, and this coordination is there means there will be less amount of duplication of services. The last one is appropriate technology. It is essential that the technology that we use should be appropriate, it should be simple, it should be sound, and it should be acceptable to the community. For this, there is no use of having large, big hospitals in the rural areas where the number of people are very less. It's good to have big hospitals in the urban areas, and the rural areas, all basic facilities should be there, which is appropriate to them. I am not telling you when you are trying to shift the balance from the urban areas to the rural areas that the government should open up big hospitals in the rural areas. That's not it. It is providing all services which are essential for those areas. Depending upon the cost and manpower, appropriate technology should be there to meet the health needs of its people. This is called as appropriate technology. Now, just to tell you in short, what are the levels at which healthcare is delivered? At the village level, you have the village health guides, local dais, ICDS scheme, and Asha workers. At the sub-center level, you have what is called as a sub-center. This sub-center is present at 5,000 in the plains and 3,000 in the hilly and tribal areas. These sub-centers are present in populations which have 5,000 population in the plains and populations which have 3,000 in the tribal or backward areas. Wherever such population is there, the government has come up with what is called as sub-center level. The amount of sub-centers which are there in the country is presently around 1,37,000 sub-centers are present. In this sub-centers, you do not have a doctor, but you have what is called as a male and female health worker, and they have other voluntary workers. The functions of the sub-center is mainly providing first aid, mother and child health care, family planning, and immunization. Second is primary health center level. In primary health center level, whenever the population has, supposing you have a population of 30,000 people, you have what is called, the government has provided what is called as the primary health center level. If it is a hilly and tribal area, if the population is around 20,000, you have a primary health center level. So the government is trying everywhere in almost all the states, wherever the population is around 30,000, you have a primary health center level. And if it is in the hilly and tribal areas, it would be around 20,000. So 20,000 population, you have a primary health center. 30,000 population, you have a primary health center. What are the functions of the primary health center? Is all the 8 essential elements which are there, which I covered up in the beginning, functions or essential elements of primary health care. All those functions are given at this primary health center. Now the staffing pattern of this primary health center, you will have only one medical officer. Depending upon the state government's budget, they may increase it to 1, 2 or 3 primary health officers. But actually what the central government wants is, they want at least one doctor, that is one medical officer for each primary health center level. At present, you have more than 24,000 primary health centers in the country. Next is community health centers. Whenever the population is between 80,000 to 1,20,000, you have what is called as community health centers. These community health centers has around 30 beds. They have around 30 beds. They have X-ray facilities, they have lab facilities, they have pharmacist shop, they have nurses, midwives, radiographers, lab technicians. All these people are there to provide all essential services at the community health center level, along with services which are provided by mainly 4 doctors. There are 4 medical officers at the community health center level. You have a medicine, you have one medicine specialist, a surgery specialist, a pediatrician, and usually a gynecologist. These 4 people are always there. But depending upon the state government budget, you may have facilities for ophthalmology, you may have facilities for ENT, you may have even a dentist posted over there who will be able to take care even of special RCT service or special oral services as well. This is called as community health centers. So this, in short, I would say primary health care, depending upon what question is asked, you must know what is the levels of health care, what is the definitions of health care, what are the 8 essential elements of primary health care, and at what levels. At the village level, you have village health guides, local dais, Anganwadi workers, Asha health workers, sub-center level and primary health center level. At the secondary level, it is also called as a primary or first referral level. This secondary health center level is basically the community health centers and the district hospitals. At the tertiary level, all specialty and super specialty services are available, and here it will be all the services which are provided by upper institutes, that is levels of healthcare. Along with this, remember about primary health centers, community health centers, sub centers and services which are provided at the village level. Thank you.